Hello, I'm Dr Swapna, consultant in internal medicine at AL-HILAL Multi-Speciality Medical Center. This is the Suicide Prevention Week. As a part of this, today I'll be talking to you about depression. About depression, it's a mental disorder which is associated with sadness, which persists for weeks to months together. Now, depression is very much different from the sadness which we experience in our lives during troubled times. It's different because in depression, the symptoms of low mood are of such an intensity that it affects the normal functioning of the individual. It affects the normal routine daily activities of the individual, and the person cannot carry it out continuously. Who are the people who are more prone to develop depression? Now, the development of depression is multifactorial. It is a combination of genetic and environmental factors which lead to the development of depression. Now, there are certain developmental abnormalities in the brain which can make a person more prone to develop depression. It can be because of an imbalance in certain substances called as neurotransmitters in the brain, which can lead to development of depression. However, depression is triggered usually when there is a major stressful event in life. Depression can affect people of all ages, from adolescents to the elderly. Now, it manifests differently in different age groups. Usually it is triggered when there is a major stressful event, like for example, maybe the loss of a loved one in the family, or maybe an acute financial crisis occurring because of loss of job or some major financial losses. In children, it occurs because of an unexpected mental shock, which can be due to any major stressful event or a very bad experience in childhood. So all these are the reasons why people get more prone to develop depression. Also, depression is common when people get diagnosed with major medical illnesses, like for example cancer or some neurodegenerative diseases. When they get to hear this bad news, they go into depression. Depression also occurs with certain medications. It could be antihypertensives or it could be glucocorticoids. Just for example, how do you know that a person is suffering from depression? Depression presents differently in different individuals. In children, it can manifest as behavioral problems, adjustment disorders, and whereas basically the real problem could be that they are depressed because of a particular reason. In women, it presents with mainly symptoms of feeling of guilt, feeling of hopelessness. They can complain of low energy levels. They complain that they are not able to carry out normal routine activities, and they don't have interest to perform any of the normal routine activities which they used to before. People have problems with falling asleep. They have early morning awakenings. Some people, whereas on the other side, they complain of increased sleep, almost sleeping throughout the day. Also, some people have disturbances in eating. Some of them have very decreased appetite and do not eat at all, whereas the others can have overeating and weight gain. When depression is severe, one of the important symptoms which we notice is that people have suicidal tendencies. So, if there is a person who is having symptoms of depression, that is, you see a change in their mood and behavior, which is lasting for a few weeks or months, and later on you notice that they are having thoughts about suicide or ending their life, a feeling of hopelessness, then it's high time to call for help. So the treatment of depression involves two modalities. One is medications and the other is psychotherapy. So if a person is suffering from depression, he needs to consult a doctor, and the doctor will decide whether psychotherapy alone is enough for the patient to come out of depression, or whether there is additional antidepressant treatment which is required. With treatment, over a period of few weeks to few months, the patient's symptoms will start improving, and the patient can get back to a normal life over a period of few months. Because of the social stigma associated with depression, some people are hesitant to consult a doctor for medical help if they have these symptoms. So what I would like to say here is that depression is a real illness. So if you notice yourself or a family member or a friend have symptoms of depression, do not hesitate. It's an illness which can affect any individual for that matter. But it is a disease which, when moderate to severe, requires treatment mandatorily for the person to come out of it. Family support and social support goes a long way in helping to bring the person out of depression. So please consult a doctor if any of you have noticed these symptoms of depression in you or a family member. Thank you.